Hey Nick, it's Dr. Leslie Treece. Thank you for asking. You sent me this DM about your baby, and I'm really sorry to hear that your baby's sick, and I hope they feel better very soon. And I can't really give medical advice on here, but I wanted to talk about some basic principles of colds in newborns and what to do, how to manage. I'm assuming that you're probably talking about nasal congestion in your baby. And if your baby has nasal congestion, it can mean that they have a cold. It can also just mean that they've refluxed into their nose, or their just nasal passages are really small and the mucus has gotten dried inside their nose. So you can use 1 or 2 drops of nasal saline in each side of their nose and suction that out just gently so you don't make any new swelling in their nose. And you really want to do that right before they feed so that they can feed better. Now, if they really do have a cold, hopefully it'll just stay that runny nose and they won't develop a cough or other issues. And newborns don't cough very well, so it's kind of difficult for them to clear all that mucus. As long as they don't have a fever, it's generally not as much to worry about. Of course, newborns have kind of a compromised immune system, and so they can get a little sicker than the average person. So you need to watch for fever and any kind of more serious symptoms, and contact your pediatrician and just make sure that they don't want to see the baby today before the holiday. And then if mom is breastfeeding, that does help because the baby will get some passive immunity through that breast milk, because if mom's had the cold or has the cold currently, then she'll be passing those antibodies to the baby. But mainly it's just going to be managing their nose and watching for fever. So that would be temperature greater than 100.4 rectally or less than 97 rectally. So, and if they do that, then get the baby seen right away. And of course, if they're having respiratory distress. Hope that helps. Ask your questions in the comments. Have a good day.